Thank you for the invitation to speak with you. It's a real pleasure to have this time together, to listen to the other speakers and also to hear your thoughts and questions. I've been asked to talk about the role of individuals in action on climate change. I have two aims: to encourage you to reflect on your role as a healthcare worker and to empower you to consider what your next steps may be, wherever you are on this journey that we're all on, working towards a cleaner and healthier planet. I want to emphasise two words I used there, because I think they're key to individual action: reflection and empowerment. In our busy lives as healthcare workers, taking the time to reflect is vital. By its very nature, we encounter so many experiences through our line of work, but the requirements on us to keep our knowledge up to date and ensure that we're giving the public the very best of care can often result in rushing from one thing to the next without taking the time to stop and absorb what is happening in the present and what this can mean for the future. We have a valuable perspective of climate change through the lens of health, and it's vital that we gift ourselves the time to fully reflect upon this. Empowerment is quite an abstract concept unless you have ever felt or feel disempowered. Quite a number of years ago, I took time out of my surgical training programme here in Scotland to live and work in Malawi. Operating with the absolute bare minimum of equipment made me really appreciate our health service here. However, when I returned, my health board had stopped using material drapes and gowns in theatres and were trialling single-use disposable ones. The stark reality of the sheer amount of waste that we create through our healthcare system really struck me hard. Instead of feeling satisfaction at the end of a day's operating, we had improved the lives of 7, 8, 9 people, I couldn't erase the sickening feeling of guilt from seeing bag upon bag of disposable waste that we had produced through these efforts. Waste that by its very nature contributes significantly to carbon emissions. The nagging discomfort arose in me because I had now seen and met and knew people with no voice, who had no personal power to impact on the course of climate change, but were likely to be the hardest hit by it. In our everyday lives here in Scotland, the majority of us are far removed from the effects of the waste that we are creating. Feeling disempowered to be able to do anything about theatre waste resulted in a terrifying dissatisfaction with my role as a surgeon. There was an irony in the contrast of being in a position with such responsibility for individual people's lives, and yet seemingly such little power to make change within the system that could benefit population and planetary health. What I recognise now, many years later, was that I was experiencing a crippling contrast between my own personal values and those values that I felt were being forced upon me through my day-to-day work. So the first thing I would like to do is to pause for a minute and ask you to reflect on where you are at present. I've drawn out a table, and on the x-axis, I want you to imagine a spectrum of what your personal belief is with regard to climate action and where you might be along that axis. Now on the y-axis is your day-to-day job and how you see opportunities within the system in which you work to be able to enact these values. I've mapped out various thoughts or reflections on how you may feel depending on where you may be on this map. It's by no means exhaustive, and please feel free to add further thoughts in the discussion box. I think it's vital for all of us to not only think about where we are on this, but the next step is then to consider both where we need to be, and thus how do we get ourselves there, and also where others may be if you're trying to talk to them about climate change. I would imagine that most of us here this evening are mostly on the right-hand side of this graph, and thankfully there are many people leading the way in the top right-hand side, people who have found ways to align their personal and work values, creating innovative ideas, sharing knowledge, creating networks and changing mindsets. In the CMO report this year, you may have read about the Scottish Environmental Anaesthesia Group, a grassroots group of anaesthetists who have lobbied for environmental information to be provided from manufacturers at the time of procurement. Check out their template for the perioperative journey called the Green Theatre Project, which resulted in the banning of desflurane within one of the hospitals in NHS Highland. I've also recently heard about Ride for Their Lives, a group of paediatric healthcare professionals who are cycling from London to Glasgow to raise awareness of air pollution, which particularly harms the health of children. They are asking people to join the ride virtually and log your miles on Strava. Many of you here this evening may already be doing just that. But sadly, there are many more of us who recognise the difficulties and barriers that exist, which make it difficult to be in that top right-hand side of the graph, or know many colleagues who sit more around the left-hand corner. There's something about being so busy saving lives that there's just no time to save the planet. Moral offsetting is the term used for this, and I'm thankful to David Pension for explaining it to me. On the left-hand upper corner is the potential for there to be people in jobs whereby they may have the decisions to make regarding procurement, energy choices, transport, infrastructure. What happens if these people don't recognise or value the opportunity they have in these decisions to influence the organisation in a positive way for the planet? What if they don't feel able to make bold decisions because they don't feel supported? I think this provides an area of opportunity for those who find themselves in the lower right corner. How can we support these people to move across to the right-hand side? There are many different things which can lead us to feel empowered enough to act when it comes to climate change. I believe that a crucial lever in healthcare is the feeling of having the permission to act. If I was talking to my younger, disillusioned and disempowered self from over a decade ago, I'd be saying, hang on in there. There are some really good things that are finally going to come into play at a national and organisational level that will give you the permission to work towards creating a healthier planet within your role in NHS Scotland. In 2009, the Climate Change Scotland Act came into power, and in 2015, Scotland was one of the first countries to sign up to the Sustainable Development Goals. Realistic Medicine, published in 2016, has a specific principle to reduce harm and waste, and in 2018, Scotland's National Performance Framework was redesigned with an alignment to the SDGs. This framework calls upon policy and service planners in public, private and voluntary organisations to commit to global accountability, while simultaneously striving to improve the quality of life for the people of Scotland. Closer to us in the health field, we have Sustainability Action, we have the Scottish Managed Sustainable Health Network called SMASH, and our Natural Health Service, which are encouraging us to recognise that changes in our work environment will drive NHS Scotland towards action on climate change and environmental sustainability. Permission to act is vital if we want to feel empowered in our roles in healthcare. Therefore, how can we make the connection between the permission which is being granted at an organisational or national level and our own day-to-day working? I think one route is via values, as ultimately these will help to create the culture in which you work and therefore either feel empowered or silenced. I'm aware that I'll be bringing my experiences from an NHS Scotland perspective, but I'm also talking to you as a colleague or a friend within this college. Innovative and inspiring, two of the values that could help us feel empowered to construct a culture which strives to create a healthier planet. Honesty, responsibility and compassion encourage us to act on behalf of those that do not have a voice. Consider how we can influence or support local environmental or sustainability strategies, advocate for fairer procurement policies, challenge the physical infrastructure which makes healthy lifestyle choices more difficult, such as trying to cycle to work when there's no access to showers. As individuals, we may feel we're only one voice, but actually, if we're not even using that voice and staying silent, then we're merely letting a culture continue as it is. We need drastic action now to improve the health of the planet. In order for huge organisations such as healthcare systems to change, we need the people in those organisations to be making the change. We not only have the permission to do this, but we also have a huge potential. NHS Scotland employs around 11% of the working population of Scotland. Let that sink in for a minute. The potential that we have within this organisation to impact on the behaviour change of 1/10 of the working population of a country, more if you can include family and friends being influenced. I find that a rather exciting target to aim for. This college has 5 different faculties and around 15,000 members spread across many different countries. This strikes me as another huge potential for mass population behaviour change for better planetary and global health. The final aspect I'd like to talk to you about is power. Think for a moment about the history that brought you to this exact point in life, both from a cultural and country aspect and also a family and personal one. There may be an unease in considering why our country has wealth, or a discomfort in recognising the willful ignorance that is adopted in order to live in a consumeristic society. We are not exposed to the consequences of how we live. Time and again, this reminds me of the public health problem that we have in Scotland regarding population obesity. It's said that we live in an obesogenic society. You may have heard this term used. Essentially, if you go about your day-to-day without actively making choices, you'll end up putting on weight. You often have to make the more difficult choice in order to maintain a healthy weight. And it's no surprise, therefore, that 2/3 of our population are now overweight. Now let's turn to our role in life as consumers. The easiest consumer daily choices are usually the worst ones for the planet and nature around us. Think through your day and take an honest look at your lifestyle, and then consider the immense power that we have as consumers. Everything from food, clothes, travel, finances, we have the power to make a choice on all of these things. I don't have time to go into further detail this evening, but there are plenty of books written on these topics, as well as local movements that exist in these areas. As you read them and reflect, consider what I touched on earlier, our unique perspective that our lives and healthcare afford us. People value good health more than material possessions, a window that we get to look through when we have the honour of supporting people at their most vulnerable times. Our lifestyles and the history that has enabled us to produce these lifestyles have disproportionately contributed to global warming. We must recognise the power that we have and take the appropriate measure of responsibility and action. For the past 2 years, I've been lucky enough to explore some of these concepts that I've discussed with you here this evening. I've been the lead on the Active Global Citizenship project, which is a collaboration between Bridge 47, ScotDec and the Global Health Coordination Unit. This work originated from conversations between Bernie O'Hare and Charlotte from ScotDec. Bernie is a senior lecturer in global health and child health at the University of St Andrews and also works in the College of Medicine at Malawi. I often wonder if this lifestyle of living back and forth in 2 very different countries gave her this quite special insight into how she recognised the many different choices available to her in Scotland compared to those in Malawi. I believe it was recognising this direct link between how the choices we make locally can affect those living globally, which led Bernie to the concept of active global citizenship. When I joined the unit in September 2019 and first chatted to the team about this work, I was immediately struck by the alignment of this concept to my own experience. Not only the discrepancy between low resource settings versus high resource and waste, but in the exposure to such extreme poverty, which does not allow the luxury of lifestyle choices or the ability to mitigate against climate change. Although this work originated from the Global Health Coordination Unit, which primarily was set up to support NHS staff in volunteering overseas, what was clear is that these frustrations didn't just exist within this cohort of staff. My friend, who is a GP with an acute passion for action against climate change, once texted me her horror at visiting her gran in hospital and being unable to find a single recycling bin to dispose of her rubbish. We all have different touchstones that bring us to the concept of global citizenship, but they are inextricably linked. We've developed a series of resources which are being launched at the beginning of November. The aim of the resources are to increase the knowledge and understanding of the United Nations SDGs within NHS Scotland, as a route to understanding how inequity leads to health inequalities, poverty causes poor health, and that climate change is a public health emergency. I would encourage you to explore them, to use them to deeply reflect on your role as healthcare workers within a changing climate. They are intended as a gift, something practical to help people feel inspired, engaged, or empowered, to use as a conversation starter amongst colleagues, and to help us all move into a place where we can feel proud to work for an organisation that's inspiring, innovative, honest, responsible, and compassionate in its response to climate change. Living and working in Malawi opened my eyes to inequality, resourcefulness, and living in the present, and the friendships I made meant that poverty is no longer faceless. I think for me, active global citizenship is a route to explicitly recognise that the way I live through my consumer and lifestyle choices, work and volunteering can make a difference to those who are disadvantaged, and it brings a hope that both people's lives and planetary health can be made fairer and healthier. So in summary, as an individual, one of the most important things we can do is read widely and reflect deeply, and thus make conscious choices. Small actions might seem insignificant until they're counted as part of a larger movement. Thanks for your time.